morning to all you lovely people watching us there. So it is a perfect Saturday evening, and we are live, and we are here where we are all set to be talking to the top medical minds. So let me welcome all our viewers. Let me welcome each and every viewer to this program who is watching us live, as we are live across YouTube as well as Facebook platforms, and you all are watching us live. And as I mentioned, that we will be talking to the top medical minds. We are just about to start, but if you are excited, so am I. Do give us a thumbs up in the chat box. Do not forget to give us a thumbs up in the chat box if you are excited. And I am the first person to do that because I am really excited. So once again, let me welcome each one of you to this wonderful evening, beautiful evening, where we will be talking to two wonderful people. And I am the little bling, the little shine, your host for the day, MC Dharna. So without any further delay, do not forget to give us a thumbs up, and let me now introduce you to the two wonderful gentlemen sitting here with us. So first and foremost, we have with us Dr. Sanjay Mittal, who works as Senior Director at Clinical Cardiology and Research Division, Medanta The Medicity. And along with him, we have Dr. Rajneesh Kapoor, Vice Chairman, Interventional Cardiology at Medanta The Medicity. I would like to welcome both of you to today's show. Thank you so much for taking out time from your busy schedules and joining us here. It is such a pleasure to have you here with us, sir.
Thank you.
Thank you, Dharna. I hope we are
Thank
beneficial to the society.
Thank you
Yeah.
so much. That is the spirit of any medical service provider. That is wonderfully said by you, Doctor. And once again, let me welcome all our viewers. Do not forget to give us a thumbs up. So basically, if you are inquisitive, what is going to happen here? Let me quickly tell you that we are going to have questions and answers with these two wonderful knowledgeable people, and they are going to throw some light on topics of some current relevance. So do not forget to ask your questions in the chat box, and let's get started. Well, on 20th of October 2020, Honorable Prime Minister addressed the nation urging people not to lower their guards in fight against corona. So my first question goes to Dr. Sanjay Mittal. Is the corona problem still as big as it was 7 months before?
Dharna, this is very important, and I think we all must realize why did the Reverend Prime Minister say that. We are health professional, and day in and day out, we are fighting people coming in with so-called minimal disease and then blowing up out of proportion. We have to realize almost 78 lakh people in India have had COVID as of now, and 7 lakh actually are running COVID as of now, active COVID disease. And 9,000, almost 9,000 people are basically sick enough to be ICU admitted. I don't know how many of them would make. We are trying our level best. But remember one thing, we are fighting to the hilt, and it's sometimes very difficult for us to manage people who otherwise just 5 days back, 4 days back were so fit that they were roaming around the roads absolutely fine and fantastic. So there is no way you can relent on this. People should realize this is not gone. There have been a little small decline in the daily cases, but there are so many reasons for such kind of happening. There is a stage-wise difference, there is city-wise difference, and also the fact that possibly us people are responsible for that decline. Why? Because we have been observing care. We have been observing control. We have been taking precautions as advised, the 6 feet distance, the masks, and the biggest thing is hand sanitization. So all those things, precautions are very important. We should never let our guards down. Otherwise, there have been countries where there is a second surge, there is a third surge, and it's quite fatal.
That's very well said by Dr. Mittal, that masks distance, and then sanitization, all of them are necessary, and we should not, put our guards down in any case, because corona has not gone anywhere. We might be in unlock 5, unlock 6, or whatever it may be, but then corona hasn't gone anywhere. So let me remind our audience one more time that we are live and exclusively streaming on YouTube as well as Facebook. So do not forget to type your questions in the chat box, because I have two wonderful people sitting here right beside us in this wonderful platform on this perfect Saturday evening. So do not forget to post your comments as well as questions, and I will read them out here, and they are here to answer all your queries. And let's move further. This next question goes to Dr. Kapoor. So, Dr. Kapoor, do only elderly population needs to exercise precautions, or it's applied to the younger ones also? What do you say?
Yeah, this is quite important to talk about in this forum. I think, we know that elderly population is the more susceptible and more vulnerable population as far as corona cross-infective infection is concerned. So now, once we talk of that, it doesn't mean that these regulations, these protocols should not apply to younger people. They are absolutely should be stringently applied to all. But having said that, we know that younger people, even if they catch corona, they have more chances to come out of it. They have more chances to withstand this infection without getting into a vicious cycle. While the elderly population, especially they are comorbid about their kidney disease or heart disease or diabetes, they may fall in a bigger trap if they catch corona infection. So, if we have to put it up like this, that these all measures should be equally stringent for the whole society, but absolutely necessary and essential for the elderly population. We can't take a chance with the elderly population, because we know, if we see the graphs, there are graphs laid down for mortality after the coronavirus infection hits anybody. The mortality figures are very low if they are less than 50 years of age. But beyond that, between 50 to 60 years, the mortality figure doubles up and it quadruples after 60 years of age. So, mortality figure reaches around 20 to 25% beyond 60 years of age. So, we can't take chances that elderly people are getting exposed. So, the stringent advice is that elderly people should not move out where more crowd is there into markets at all, even now. Until unless a real urgency, they should not move out. While younger people can move out with all the caveats, with all the masks and social distancing. So measures are for the whole society, but absolutely essential for elderly. I will put it up like this.
Wonderful. That's so, yes, yes, Dr. Mittal,
Yeah.
please.
So one thing which Dr. Rajneesh very clearly spelled out, that younger people can go out and they rather go out, but all those three precautions have to be there. 6 feet distance. They should not consider themselves invulnerable. One thing again, Dr. Rajneesh was mentioning, they are the biggest source. Even if they don't get complications, they are the biggest source of contaminating the elderly people who are stationed inside. If my mother is there, I go home, catch infection, go home, she would get infected, and I would be responsible for that elderly people's demise. So that is something which is a big blot on me. I should not be responsible for somebody else's ill health. That is one social responsibility every young person should have. And second thing, which is also very important, is these younger people, if suppose nobody's invincible, if suppose they have a complication and they lose their life or health, this is a bigger loss to the nation, because they are more active and the nation will lose more active physical life. So that is a bigger loss to the nation. So they should obviously take care of themselves. There is no reason they should ignore their health.
Yeah.
True. And adding to what both of you said, I have something else. We talk about younger people going out. They can go out. They should go out. Of course, they are the productive population of the country, for sure. But then, what about younger population with the comorbid condition, coexisting comorbid condition? Somebody who is 30 years of age or maybe 25 years of age but has chronic asthma. So that person is also very susceptible. So I think uh, unnecessarily going out is never a good idea in such a time, and maintaining all the three things you said, Dr. Mittal. Masks and the social distancing and sanitization is very, very important. Extremely, crucially important.
Dharna, one thing more which I would like to say is that even if
Mhm.
a person is young and does not have comorbidities, okay, if the person has comorbidities, there are higher likelihood of person having complications. But does not mean if you don't have comorbidities, you will not have a complication.
Mhm.
Rather, this is the biggest problem which people should realize, that everybody should keep themselves protected.
Yeah, so
That's
I'll
how.
just extend this statement further because the
Mhm.
biggest point with COVID infection is highly erratic and unpredictable. It the If out of 100, 95 people have done well, that doesn't mean the rest of the five will also do well. So it behaves
Absolutely.
erratically. The lung fibrosis which it causes, it's totally erratic, and people may go downhill in first 3 or 4 days. So in those cases, it's kind of a malignant COVID infection, and those cases are very hard to come out of it. They are at a very high risk of mortality from COVID infection, where they go downhill and they require ventilatory facilities. So that one has to keep in mind that nobody is immune to this, and nobody can think that they will come out healthy out of COVID, because it's absolutely erratic.
Right. And
And one
yes, sir.
And one thing more, which is coming out of the literature, is that although the disease might have been mild, so-called mild, but there have been long-term ramifications of the disease. People have found out that there is cardiac involvement or swelling in the heart, which they find out in the MRIs after 2 3 months. People have been dying suddenly, although the disease was mild, and they do exercise and they just collapse one day. So it's not that you just have a little bit of upper respiratory infection, URI, Jukam, Khansi. You can still have a problem. And it is so much, just like what Dr. Rajni said, beautifully said, that it's so erratic. It may be surfacing out with milder symptoms, but it may be involving deeper organs. Various fluids in the bodies have found to have viruses. So it's so unpredictable. Don't just be foxed by mild symptoms. It can be hitting you harder elsewhere, which people don't realize.
Yep.
Right. That's very correctly said that it is so unpredictable, unlike a regular URI or something. So I have a question. Meanwhile, many patients are not getting their PCR test in, and many doctors are also not insisting on the test. Such patients are not only likely to get serious disease but PST COVID fibrosis also. This is by Mr. Manmohan Talwar.
I think this is precisely what I was trying to say. It's
Actually.
always better first to realize that symptoms of a little bit of URI, Jukam, Khansi could be COVID. You have to protect yourself, and more than protecting yourself, your responsibility is to protect your near dearest ones and your friend circle. So that is something which is added, and it's always better to get yourself tested. Why the people are not getting tested? There could be some hospital, the states policies, or city policies, or hospital policies. But I think there is no reason. You have the whole right to actually press. If you have slightest bit of suspicion or symptoms, you should get yourself tested. Mind it, one more clarity I want to give you. The best test, RT-PCR, also is at best 70 to 75% sensitive. That means there is a chance that first test may still be negative. If you have symptoms, you may get it tested again. But there is no second thought. You should get tested if you have symptoms, or contact a relevant hospital or society where the things can be tested for you.
I
That is
absolutely concur. I
correct.
absolutely concur with this, because more the tests done, more you can control this disease. If
Mhm.
you don't do tests and somebody is moving who's COVID positive but mild symptoms or asymptomatic in the society, we don't really know that how much infection is spreading in the society. So more tests should be done. even with milder symptoms, even with somebody who has a clear history of exposure in the vicinity, they should be tested. There's no question. So we should rather, as physicians, we should have this responsibility of putting it to patients or whomsoever is coming where the suspicion is there, to emphasize on the fact that they should go and get tested.
Right. And in the meanwhile, I have another question. This is by Ripu Daman Korla, and this is from one of our Facebook, one of our YouTube streaming. So he's watching us live on YouTube. In my locality recently, few COVID cases have come up. Apart from throat pain, they don't have any symptoms. Any suggestions which we can send in locality groups as precautions? Who better than you people to throw some light on this?
So
Starting
this is
with
this
Dr.
is
Mittal, yes.
yeah. So this is absolutely right. If you have a cluster of cases coming up, this means the area is vulnerable, and people should, in any case, the biggest problem which comes is when there was a lockdown, people were segregated and separated. But once they start going out of the house, they they lose those three principles, of social distancing, 6 feet at least. Then it is actually 10 feet distance when you are in closed spaces. 6 feet distance is for open spaces. Second thing is mask, and third thing is those three golden principles of hand sanitization, mask, and social distances has to be maintained. And once you give it up, at workplaces, at marketplaces, you are vulnerable to get infections. So if you are living in a society with a cluster of events, please maintain your responsibility. One, as a non-infected person, you should maintain a social distancing from everybody. You may have symptoms or you may not have symptoms. You may still harboring a contact infection. So it's better to treat anybody in front of you as a potential suspect and treat a social distancing. Don't cut that person out. You have to still be polite and light and communicative, but you maintain those three principles of distancing. Second thing is, if a person is infected or milder symptoms, it's that person's social responsibility that the person should isolate himself or herself and get himself or herself tested and treated.
Right. Social responsibility here, I believe, is a very important thing. So let's take this discussion further. Let's move forward. And Dr. Mittal, this question is for you. What is the concept of herd immunity, and is it a solution?
So let me just first dwell on what do you mean by herd immunity. Herd immunity is if, suppose, a virus infects me, it would cause some symptoms, and after those symptoms, I'll get antibodies or substances which would kill the virus and protect me from further infections. So then I become a barrier. If I have a herd immunity, that means a certain amount of population in that community getting infected, they would stop the fire from spreading. So it was something which was being used in the jungle. If there is a jungle fire, if you clear a particular area out of the jungle, it stops the fire from spreading. So that is the concept of herd immunity. But you have to understand there's a lot of unknown and unreasonable facts about herd immunity. A lot of factors determine herd immunity. That means clustering. So if there is a crowded place, maybe 60% of the population has to be infected before it gets to the herd immunity. But if you are rarefied, just like Finland or any place where there is a very low density of population, even 20% population infected can lead to herd immunity. But second thing which we also have to realize, the problem with herd immunity is we assume there is only one virus. But this nasty virus is so misbehaving and so unpredictable. It is changing its face every now and then. And that is something which we call as antigenic drift. That means the virus changes its morphology, which would mean if I got infected by virus A type COVID, I can get infected by B type COVID, even though I have immunity to the A type COVID. So that is something which has to be understood. Second thing is, I am not very clear, and nobody in this world is clear, how long the antibodies would last. If I get infected, would it last for a few weeks? or would we last for a few months or 6 months, 7 months, 8 months? So that is something, there are a lot of unpredictable things about the COVID. And that is why, if you remember, countries who actually indulged into herd immunity, they had to give it up because the load of disease was so horrendous, they could not tolerate, they could not bear those herd immunity things. Italy is an example, England is an example. So they had to give it up. So we have to be basically safe. We keep social distancing, hand hygiene, and masks. There is no there's no second choice about it.
Right, that is very clearly visible from what Dr. Mittal has said. It's clearly evident that there is no second choice, and we have to, keep our own safety. And let's take this forward and let's touch upon another point. So, Dr. Kapoor, this one goes to you. There are studies talking about heart damage from COVID, but isn't it a respiratory or lung infection disease only?
Yeah, so this is something again very important to talk about here. That primarily, COVID is a disease of a lung tissue primarily. So once I say that, it doesn't mean that it doesn't involve other organs. It involves other organs, but most common presentation is usually cough and fever and respiratory distress. So how does respiratory distress occur, and how does it involve lung tissue? So we in lungs we have alveoli and alveolar and vascular membrane across which the gas exchange happens. So that exchange area is the main target of this viral infection, and that alveolar membrane gets distorted and it gets damaged with the inflammation this virus is causing into the lungs. So now you can well imagine. Now, once that area is disrupted or damaged, the gas exchange gets totally disrupted. The oxygen which goes in across that membrane and the carbon dioxide which comes out across that membrane is totally haywire. Oxygen is not going in. By virtue of that, the oxygen saturations will go down and carbon dioxide starts accumulating with a more advanced stage. So the first symptom is the desaturation. The oxygen saturation starts going down. That is where we say that this is primarily a disease of lungs. Now, we have seen many cases where the damage is so significant and so horrendous that despite taking all measures, despite giving all possible best stringent non-invasive ventilations or the invasive ventilations, it's not going to improve because there is no membrane where exchange can happen, right? So oxygen levels do not come up, and that is where one is heading towards a mortality, in those more severe cases. So this is the thing, the pathophysiological situation where COVID virus is affecting the lung tissue. But having said that, there are cases where it is also now dominantly involving heart. So it's a heart and lung involvement majorly. So or how the heart is being involved? Now, the virus is leading to a lot of inflammation, lot of inflammatory mediators like interleukins. So those inflammatory mediators, they also start getting collected into the lung, into the heart tissue, which is a myocardium, and leading to very severe inflammation, which is known as myocarditis. So we do see, and we are seeing many cases where heart is also dominantly involved, and that can lead to heart failures or rhythm problems, and again raising higher chances of mortality in these patients. Now, only differential point is that in patients where the lung tissue is involved, the recovery from the lung tissue damage is very slow. Where it has been damaged by COVID infection, usually it takes weeks to month or 6 weeks or even 2 months. But the myocarditis, once the patient is getting weaned off from COVID infection, once it is subsiding, in few weeks it's definitely subsiding and it's improving. So heart tissue shows a better improvement as compared to a lung tissue, which is damaged more extensively. So primarily it's a disease of lungs, but can involve other organs. The inflammation can involve other organs, and heart involvement has been seen quite frequently in such patients also.
Right. That is very the correlation is very correctly explained by Dr. Kapoor here. And meanwhile, I'd like to remind our audience that we are streaming live and exclusive on YouTube as well as Facebook, and like there can never be a better opportunity to interact with these wonderful people. So, whatever questions, whatever queries you have, do not shy away. Do not forget to ask them in the chat box in the comment section, and we will read them out here. We will read your comments here, and your questions will be answered by both these clinicians. So, moving forward, let's touch upon another very valid thing. There's an advertisement from Government of India motivating people to object a person who's not wearing mask. You think this is vital? So let's start with Dr. Mittal.
It is absolutely vital. I think just like there is a rule about not driving the two-wheelers without a helmet, there should be a punishable activity not to roam around with a mask on. And the mask does not mean just a mask. Mask means nose and mouth both covered. So that is something which is very, very important, that you cannot roam around with the mask without the masks on, and this should be a rule. The second thing which I want to say is that in that pretext, I do have a soft corner for certain group of people who actually cannot wear masks. We have to be responsible. Those people better stay inside the house. And what are those people? Elderly people who have certain disease, people who have heart disease. If they wear mask, they may have decreased saturation, oxygen coming into themselves. Heart, lung disease, people who have asthma and all, if they wear mask, there would be a problem. There are people who have claustrophobia, and when they wear mask, it would feel to them as if everything is. So better for them to keep themselves in-house or secluded, keep 10 feet distance from any other person. So that is fine, but they are best protected inside the house rather than outside the house. It should be a rule that nobody should be allowed without a proper mask. Proper mask. I would say the adjective should be a proper mask. One more thing which I would like to say, as Rajneesh was beautifully mentioning about the cardiac disease, I would like to just mention about one of my own experiences. And in Medanta, we are looking at a lot of people who are coming after 2-3 months of so-called mild COVID, and they had some pulse rate which was high, or some apprehensions or these things. And when we test, the MRI shows scarring, or MRI shows edema even after 2-3 months. And that is actually in proportion to what was the report from one of the US journals, which showed 78% of people who were subjected to MRI after 3 months of COVID, even mild COVID, they had MRI abnormalities. So heart is definitely getting involved. Even if the COVID was mild, it is definitely getting involved. It's not nice for people to roam around thinking they are invincible. Nothing is going to happen. One fine day, they can drop dead. People have been known to drop dead because they had no symptoms whatsoever. They started exercising and they collapsed. So we have to be very responsible to ourselves and to the society. This is something which is not government's role. No government has a role or governing this thing. Each individual who is a social human being should have that responsibility. We are all social human beings. If we don't have that social responsibility, we are unsocial.
Right, and that is again very well said, Dr. Mittal, and like. This is to the audience, basically. This is to the audience that apart from that sore throat, or maybe your stuffy nose or runny nose, there are long term effects, maybe not immediate, but then in the long term, as Dr. Mittal mentioned. So there are effects that we do not generally see just randomly, but then in long term, in long run, we do see those effects. So stay safe, and that's incredibly important. So, coming to Dr. Kapoor, about wearing masks, the same question to you. What's your viewpoint on this?
So I think, firstly, there is one video. If somebody has gone through this, there is one video on the social media, which is there for a few days, that in Singapore airport there is one girl who was not wearing mask. She was captured by the police. So this is how the Singapore country actually makes rules, and they execute that also very well. So I think it should be a penalty-driven thing. Like Dr. Mittal was also pointing out nicely that if we don't wear seat belts, it's a penalty, because one can meet an accident and lose its life. So similar situation is here. Here, even if even this is more devastating, because that person may not be risking his own life. He is also putting other people in the vicinity at risk. So I think, one, it should be more stringent regulations from the government. It should be some penalty or something. Now the penalties can be, which I thought, I was thinking one day, that any shopkeeper, if at all somebody is going to that shopkeeper unmasked and somebody finds it on camera or something, that shopkeeper should be penalized, and again should be said that your shop is locked for another 10 days, you can't open it. So something related to this. And this is also true that we as Indians, they require stringent regulations to follow. We require more penalty driven things rather than we follow the things as it is. So I think it should be penalty driven. There should be fines. There should be more stringent regulations from the government itself. Only then the people will fall in queue. That is my thing. But yes, now there are things economically we have to come out. The things have to open up, because otherwise our economy was also going pretty down. But that doesn't mean that we should take it lightly. Take the three things which have been mentioned time and again, Dr. Mittal and you all have pointed out: the sanitizer, the mask, and the social distancing. There is no scope that one should just take it easy on this. It has to be very stringent and meticulous in the society by everybody. So this is the again and again the repeated message, and it should be penalty driven. Something government has to come out on this.
Right, that is very rightly said, and I've seen at a lot of places where it's written clearly written, mask nahi to petrol nahi. I'm sure everybody of you have seen that, mask nahi to petrol nahi. So these are the kind of gestures that we look forward to from people. Maybe a shopkeeper, maybe a petrol pump owner, and these are just examples. We can be like really innovative in our approach if we want to enforce anything. So stringent laws obviously are required, but then we should be really innovative in our approach. And we've seen, I'm sure a lot of our viewers would agree to it, that in smaller cities, in smaller towns of India, in villages of India, people are not adhering to all these things. They are not wearing masks. I've been to a very small town of UP 10 days back, and only the 20% of the population was wearing masks. And when we were going out in public with masks, people were staring us like aliens. This mindset has to change.
Yep.
So one thing which Dharna, this is wonderfully said by you. One thing which I just want to mention is there has to be a conceptual change. You know,
Absolutely.
people who do not wear mask, they should be treated as if they are hurting others. There is a difference between committing a suicide and committing a murder. Murder is punishable; it is a crime. So they should not be bold enough. Those people think they are invincible and they are brave not to wear masks. They should be treated as committing a hurt or injury or murder or discomfort to others. So that is something why this should be a crime. If smoking in public spaces is a crime, wearing no mask is also a crime.
Absolutely, very well said. And I'd like to remind our audience one more time that you can keep posting your comments and questions. Our inbox is already getting flooded with questions from all of you. So do not hesitate to post your questions in our comment box. And in the meanwhile, I have something from the Heart Care Center where Dr. Manmohan Talwar, senior physician from Talwar Hospital, says, is it justified to start cinemas and religious places uh, where the closed chamber is likely to infect all present together for few hours? Let's start with Dr. Kapoor on this.
Yeah, so I think this is a very nice question. Now we know that the cinemas are going to open, and although with the caveat that it has to be a 50% occupancy and one seat, alternate seating only can be permissible. So it's a double-edged thing. So on one side, as I mentioned, it's 7 8 months and everybody is feeling the brunt of it economically. So business has gone down, and the movies business or the cinema business, that has also taken a big brunt on it. So a government has to think on both angles. From that angle, they are thinking that they should open up the cinemas with again some stringent regulations of 50% audience only. But yes, on if we talk of only infection, I think it's going to be a counterproductive mechanism again. So it's a closed chamber, and anybody, if even if it's asymptomatic positive into that cinema hall, can actually be a super spreader, can act as a super spreader there. And obviously once the virus is into the closed chamber, it can really infect many at that point. So both things, one has to be very very careful. I would go one mile more on this, so it's fine if they are going ahead with cinema, opening up the cinemas. It should be more stringent that everybody should be checked for COVID. They should look at the COVID report, that they should be negative, and then allow it. I think this is again important. Fine, if they want to do business like airlines, what airlines are doing or what other countries are doing, they are asking for a COVID negative report before travel. The other countries, you are allowed to enter into Gulf countries or European countries. Even if you are traveling, you should have a COVID negative report. So COVID negative report is hardly 1,500 rupees now. If you are trying to spend 4,000, 5,000 on a cinema going to see a movie, then why not additional 1,000 rupees for a test? So I think we should think of all these things. But as I mentioned, it's a double-edged thing. Government has to think of other things also, not only the infection, because as I mentioned, economically it's hitting everybody. So from that perspective, they are opening up cinemas. But from an infection point of view, this is not good.
Right, that is absolutely correct said by you. And we are probably into the last 10 minutes or 8 minutes into the discussion with both these wonderful, knowledgeable minds. So I would one more time request our audience members to share your questions, your thoughts with us before we end today's discussion. And with this, I would move to Dr. Mittal. Dr. Mittal, your take on this.
So I agree with you. There has to be a balancing approach. Opening cinemas and clustered closed spaces where the chances of infection is high, the religious spaces where you actually have to shout or pray and there is a clustering of people, has to be avoided. There has to be no way, but we have to find a solution. So the way we find a solution is, say, for example, IPL is happening. How is the IPL happening? There is
Without
no
audience.
there is no audience, but a game is going on, and people are watching that in the homes of their own self. So there has to be a thought process which should go on. Just like Dr. Kapoor said, they should have carry a negative report, but that negative report also should be within 3 days. Beyond 3 days, there is no validity of that report. If there is no symptoms, who's going to check the symptoms? So it's better to have 3 days validity. But I would say one of the ways is to boycott that. If I have an opportunity to go to the cinemas, why should I go to cinemas? Who's pushing me to go to cinemas? Can't I find something else? So less than 50% metros are on, right? Metros are on with 50% capacity. There has to be a prior booking, prior mechanisms. So some things of that sort, what Dr. Rajneesh was mentioning, can be communicated and addressed to. But in my opinion, it's not a necessity of life. People can easily learn to avoid it. There is right now enough entertainment at home, and you can utilize those services.
Yes, so with last 10 minutes into the discussion, my inbox is getting flooded with comments and questions. So I'll quickly read them out. This goes out to Dr. Kapoor. This is from Mr. Devesh Verma, who's watching us on YouTube. So he says, now after 7 months that we know a bit more, how real is the fear of virus getting stuck to hair, clothes, etc., surface contamination, no people diligently taking bath after reaching home, and I believe that is it.
So, what I'll do is I'll just begin, then Dr. Kapoor can add his comments on it.
Mhm.
In my opinion, unfortunately, yes, the virus can stick to the hair, the skin, and the clothes, and it
Mhm.
may remain there for a while. But there is no definitive evidence that it would lead to an infection until unless you touch your golden area here, even the eyes for that matter. The second thing is that goes besides saying that you have to maintain hygiene. It's always a good health. Whenever you go to home, always maintain a hygienic kind of a sanitation. Take a bath, put your clothes into a bin where you can wash that with the higher temperatures. Specifically, if you had visited to a place with lowered guards, the guards of the three, social distancing, 10 feet, the masks, and the sanitizers, hand sanitization. So it's important that if you are in a vulnerable population, say for example, we people, if we are going to the hospital, we do not know who comes to us has got infection or not. So I would definitely come home and take a bath and take a sanitization, because whatever anybody says, 7 months of thorough research and activities, but still there are a lot of questions which are not yet answered. Minded, the research which has been published today in most of the journals is hearsay research. They have an experience of 200,000, 2,000 people that comes out with a paper, which is a confusing message. There's hardly any systematized long-term research. Many of these things take lots and lots of time, not weeks and months. It takes years for coming out of those criteria. So that kind of data is still not there. And still that data is very clear, crystal clear. I would still suggest, if you are vulnerable or going to a crowded place with a potential infection, get yourself properly disinfected by putting your clothes into a wash bin and taking a bath.
Right, and there was another part to this question by Mr. Devesh Verma, who don't bother about it. What about people who don't bother about it?
So people take a plunge from a skydiving knowing that there is a high risk of dying. There are going to be crazy people all around the world. This sometimes people actually feel that is their bravery. That is their bravery. But you have to understand, as I said, it's not their health they are putting at risk. It
Right.
is the health of their near and dear ones or their neighbors and their friends they are putting the risk to. So their responsibility is not just to take health care of themselves, but to be socially responsible for the health of their near dear ones. If because of their foolishness something in the family suffers, it's the biggest crime they can commit. Probably they would never be able to forgive themselves.
Perfect. So, with almost last 5 minutes of the discussion, I have something very relevant question asked by Ayushi Agarwal. She's following us on Facebook. I start with Dr. Kapoor on this. Sir, can you please give advice about ordering food from outside? Is it fine now to eat outside or order from outside? Dr. Kapoor, your take on this.
Yeah. So these are all things which are happening around us now.
Of
After
course.
after spending 7 8 months, people also want to come to the level where they were pre-COVID era. To order food from outside, to move out into the markets. But still, as Dr. Mittal has pointed out repeatedly, I think still the fear and scare of COVID is not over. Rather, you can decipher what happened in Kerala. So there were some festivities going on, and they had a second surge. So I think more we become relaxed, more vulnerable we are for second surge, and you never know. As I mentioned prior, also it's going to be very erratic. Who gets into the trap? Who may escape? So it's unpredictable. So we have to be still cautious. We still should be doing things which are absolutely essential and not doing things which are not really necessary or essential for our day-to-day life. Even if we want to move out to a market, we have to be very vigilant of all the precautions. See, we are doctors. We have not taken a single day off in all these 7 months. We kept on working, but we worked with all the caution. So that is where the we want to preach a lesson and teach this that things can be done, but with a proper caution. Even if you wish to order a food from outside, there is no crime in that. You can do that, but be vigilant. First, try to find out that all the hygienic stuff is being done from where you're ordering food. That's number one. Second, whosoever is bringing you never know the status of that guy. While you take a food, it has to be a switch of envelopes, the switch of lifafas in which the food is brought. You can have your thing ready and discard the thing there. And then obviously the food is boiled. So there is a rare chance that food brings the virus. It's the person contaminated is bringing the virus. So then sanitize everything. Sanitize everything which is coming to your house from outside. We have lots of sanitizers available now. So properly sanitize each and every stuff before it enters your house. So once we are taking all these precautions, still things can be done. And it's nothing something which we are talking out of the blue, out of the box. It's very general things. The problem is once we tend to forget these things and then we fall in trap.
Right. So the next question comes to you, Dr. Mittal. This is by our viewer Nikhil Gupta, who's following us on YouTube. He says, "Sir, what is the risk of getting heart diseases after COVID positive?" So you've already touched upon it a little bit. I'd like you to elaborate more.
So it's a wonderful question. Heart is very commonly involved in COVID scenario. Lungs are the symptomatic ones, but heart is the poor guy. All the data shows if you have a heart disease, if you have diabetes, if you have hypertension, you are more vulnerable to complications. That's clear. So there are few things which can go wrong. Four things you have to remember. Point number one, if you have existing heart disease, you are much more vulnerable of developing complications of COVID because of stress. Because if you have angina, because of the stress of COVID, you can have precipitation of angina or heart attack. Second, COVID can induce thrombosis because of that immune response. The clotting in the arteries can happen, and this can produce heart attacks or even brain strokes without major blockages in the vessels of the heart. Third thing is when you have a cytokine storm, the whole bloody body is flooded with those inflammatory storm markers. This would lead to stress, which can lead to depression of heart muscle function. That is something which can happen in any other cytokine storm. Many other disease can cause it. And fourth and finally, there is an evidence that the direct muscle injury can happen with the virus. There has been autopsy reports where virus was identified in the heart muscle. So there is no second thought that virus can involve. And as I said, almost 70 to 80% people with so-called mild COVID, when they were tested 3 months later with MRI, were found to have inflammation or swelling in the heart muscle by MRI. So it's not so innocuous.
Right. That's again very well articulated by you, Dr. Mittal. And this question goes out to Dr. Kapoor. This is probably not related to COVID, but this is by Hina Arora. She asks, can air pollution increase heart attack risk?
Mhm. So we are entering into a zone where the pollution is going to rise. So I
Yes.
think I can see the anxieties coming from that regard. So usually this is the time once the Delhi air gets really smoky, I would say. So anyway, I think air pollution is very deleterious to health. Air pollution primarily is more deleterious to lungs and our breathing patterns. But then, the air pollutions are again known to be deleterious to many organs. Once our lungs go bad, there is chain of reaction which goes in the body again. So, there could be respiratory problems. So those respiratory problems can occur as triggers for heart problems. Air pollution directly may not be leading to active heart disease or something, but yes, we do come across many patients, more increased frequency of patients once the pollution levels are higher, even in terms of heart disease. So heart failure chances and even the heart attack increases secondarily because of the stressful things happening to the body because of air pollution. So I would put it like this, that you know uh, we should have we should have more ways or more options of having a fresh air, which I trust the governments are doing a lot in that direction, but still inadequate. They should look for more things. So to have a fresh air is a right of every people, and air pollution is not good in any manner. It's going to be deleterious in terms of respiratory infections, in terms of aggravation of asthma, in terms of triggering heart disease further, and also triggering blood pressure further. So it's a vicious cascade of events which is.
Yes. So, as rightly mentioned by Dr. Kapoor, it's a vicious cascade altogether. With last 2 minutes into the discussion, let's request both our clinicians to give advice to all our viewers who are watching us here. Let's start with Dr. Mittal. Dr. Mittal, what do you have to say to our viewers as we end this discussion?
So I would say, my friends, my brothers and sisters, I would like to tell you, everybody, please take full care of yourself. Although the lockdown is over, you are allowed to move out of the house and into your workplaces on freedom. But it's not all gone. And the virus is still there, very much there. Rather, it's leaping with leaps and bounds, and it might infect you, and you may not be so invincible to the virus negative effects, even if you are young and protected. So keep yourself protected, keep social distancing at least 6 feet, even on workplace. Don't put down your guard. Keep on your masks on, and hand sanitizer. Whenever you touch anything, before you touch your face, you have to sanitize yourself. So that is something which is very, very important. Please don't breach it. हिंदी में कहावत है, सावधानी हटी और दुर्घटना घटी. And I'm quite sure that you have to be very cautious about what you do. You are responsible for not only your health, but also your near dear ones.
Thank you so much, Dr. Mittal, for this advice. Lovely piece of advice for all our viewers. Moving on to Dr. Kapoor. Dr. Kapoor, your piece of advice for all our viewers.
Yeah, so I would carry on from where Dr. Mittal has left. And I think this is the festivity time. So I would urge that we have to enjoy the festivities. We have to be really looking at how best we and our family can enjoy that. But then this is unprecedented time. We should be very cautious. One very big way of defeating this viral infection, besides, so I'm not repeating what Dr. Mittal has already narrated. I am saying eat a very healthy diet. You should look at how you can improve or enhance your immunity,
Mm.
because if you have a bigger or robust immunity, then you can defeat this infection. Even if it gets into your body in a bigger and more successful manner, you can erase this infection out of your body. So eat more proteins, eat more minerals. How you can do it? More salads, more fruits, and more vegetables, more organic food. This is important for you. So eat a better healthy diet to be more immune to infections which can get you in trap. So that's my final message.
Thank you so much. That's very wonderfully put together by both of you. So this is to our viewers, we are into the new normal, cannot do much about it. But do gas ki duri or mask hai zaruri. That's the mantra, I guess. Stay brave, but do stay safe because health is wealth. And if health is lost, everything is lost. So stay safe. And with this message, we will close this discussion for today. But do watch out for this space for more such discussions coming up right your way. Thank you so much to all our viewers for joining us here tonight. And thank you so much, Dr. Mittal and Dr. Kapoor, for joining us here in this wonderful discussion. It was a great session with both of you here with us. Thank you so much for joining in.
Thank you.
Thank you
Thank
very
you.
much.
Thank you once again to all our viewers. Thank you so much for joining in and keep watching out this space for more such interactions, more such discussions. This is your host, MC Dharna, signing off for the day. Thank you so much. That's been my time. Thank you. Have a great Saturday evening.
Okay. Bye.